I did a very extensive research in the internet, and I chose several of the programs that were web-based, and the one that I got the best cooperation from the developers in order to customize it to my needs as a neurosurgeon was from Waiting Room. I tell you, my research was about 2 or 3 months testing several systems, and Waiting Room, I'm extremely satisfied with the way that Waiting Room solutions work for me. Well, for a surgical, I can tell you the billing. For example, I finish my case and I go to the computer in the operating room. Our hospital, everything is computerized, so I have to go to the computer in order to do my dictation and my orders. And immediately I just log to my waiting room solution from the hospital, and I do the billing right away, and it's sent. My office sends the billing the same day. Even as soon as I'm finishing the surgery, the billing is on its way. Well, some patients that have internet access, they can log in and load information of their medical problems and her medical history into the system. So when the patient comes to the office, it expedites the process of the patient being in the office, waiting for me to see them. So when they come, basically they are ready to be seen. They have everything there on hand. They just with a click in the mouse, they get the order, they get everything. Well, it's compatible. I use Dragon Medical System for dictation in the office, and it's compatible with waiting room solutions. I simply dictate into the waiting room solutions everything that I want to do. So I see the patient, and in less than 5 minutes, everything is in the chart. Well, number one, it's good with Medicare, because when you use the prescribing, you get your Medicare bonus. And the patient sitting in my office, I just can tell the patient that the prescription is waiting for him in the pharmacy. So that's really an advance. And number two, by doing that, you're making it more secure. So because by calling or things like that, people can just call using your name and get false prescriptions. Well, for me, it's affordable, based on, as I mentioned earlier, that every time that we would get an update with the other software I was using was several $1,000s, plus we had to update the computers in order for the update to work, plus the time that the secretaries would get used to the new upgrade, and the time that the people that were installing and fixing the problems with the computer communication were there was really expensive. Every year was expensive in that sense. Waiting room is just one monthly fee that I pay with all the capabilities of the system, and definitely at first you would look at a figure that seems to be expensive, but in the long run it's a lot cheaper than having to upgrade your software every year. Yes, every time that we need, for example, if I want to change one of the forms I use for history or for billing, my experience has been that we give them a call and I get a response. If not immediately, we get a response within the next couple of hours, and the solution for the changing the form or doing whatever alteration I want to the form, within the next 2 or 3 days I have that available. The system is quite intuitive. Just by going through the pages, at least for the part of the surgeon, is simple. You need to have training. If you want to modify and create your own templates, the health part of the system is also very helpful. But again, it's very intuitive that you can create the template just by looking at it, and you realize that you can do it yourself. And the staff, they have no problem on that. I think you guys have periodic webinars on the new thing that you add to the system, and that helps the staff to stay updated. But they also go to the health part, and they learn that quick. I really haven't had any problem with that. Well, for me, it's not a problem. I just love it. For example, for surgery, I normally dictate my histories and physicals. The night before the surgery, I just sit down after my dinner, log in to the waiting room, and I have the patient that I'm going to operate the next day, and I dictate that for the hospital. So it's right away. I finish dictating as soon as the patient leaves. I finish dictating, and I have all the information available, as I mentioned to you. One thing that the primary care doctors like is that they like to have, when you see a patient, what is your thought about the patient and what you're going to do with the patient, and we send that right away. So I have been, even some doctors have mentioned to me that my office is very good on sending them the report, because we expedite that. As soon as I finish, they fax it through the same waiting room solution, so they get it right away. When a patient comes to the office, I have a piece of paper where I write down more or less what the patient had, so I can dictate from there. And as soon as I finish the dictation, we throw the paper away, and absolutely, my office is paperless. Before that, even with the other system, we had to keep some records and charts. Oh my goodness! Definitely, we don't save any paper here in the office of the patient. As a physician, I can tell you that I did a very extensive research of all the web-based programs, and I found the most ideal for a physician, and also was probably the cheapest one, or the less expensive of the programs. So for me, it's affordable, and it's definitely doctor friendly. Depart from the doctors, and my staff had really no complaints about the system either. So it definitely helped the office staff to achieve everything that you need in a complete EMR.